Vancouver just announced a new 911 program specifically for people with non-emergency health concerns.
The city says its dispatchers field thousands of non-emergency calls every year, and the demand is really falling on its first responders. So the goal of the program is to alleviate some of that stress.
Fox Mia Villanueva joins us now in the studio to tell us how the new program works. Good morning.
Kim and Shauna, good morning. The city of Vancouver maps it out with a graphic on its website, so take a look this way. So to access what's called the Clark County Nurse Navigation Program, it starts the same. You just need to dial 911. You'll then be connected with a dispatcher. Then that dispatcher will ask you if it's a life-threatening emergency that requires an ambulance or if you should be connected with a nurse. Now, that nurse will help you to determine the right level of care for you depending on your situation. So whether that be taking yourself to a clinic, contacting your primary care provider, that nurse also has the ability to connect you with an ambulance if need be. Now, the city of Vancouver partnered with Clark County and American Medical Response to launch the program in an effort to lower the number of non-emergency calls that its 911 dispatchers receive. Now, the city says it gets about 14,000 non-emergency calls to 911 every single year. Now, even with the launch of this program, you still should not call 911 for minor illnesses or injuries that can be addressed by your primary care doctor. But if you're experiencing trouble breathing, chest pain, fainting, seizures, any other urgent matters, call 911 right away. For those emergency situations, the dispatcher will likely forego connecting you with a nurse and send an ambulance. But again, if you do get connected with a nurse first, that nurse can still dispatch first responders to your location. Now, Clark County joins 10 other states in their launch of the Nurse Navigation Program. Again, to access that program, it still starts with dialing 911. The program will launch on May 16th. In studio, I'm Mia Villanueva. Good day, Oregon.
Mia,